I am pleased to announce 3 new investments as part of our domestic biomanufacturing strategy, including supporting a promising therapeutic candidate developed here in Canada. First, we're helping Novacol Pharmaceutical expand their facilities in Cambridge, Ontario, to create a high-speed fill and finish line. As you may know, fill and finish is the packaging stage of the vaccine and therapeutics manufacturing process. We know that Canada has gaps in the availability of this kind of service here in our country. So this is a key supply chain investment that we are doing to improve resilience here at home in Canada. The Novacol project will also help create 25 new highly skilled jobs while maintaining their existing workforce of about 350 employees. Le deuxième projet.
The second project that we will be investing in today was also selected to increase our global capacity in fill and finish in Canada. We will be working in partnership with KABS Laboratories, KABS Laboratories, to grow their facilities in Saint-Hubert and create new facilities in Val-des-Sources in Quebec. That way, KABS Labs will be able to fill and finish more than 30 million vials per year in Saint-Hubert and produce antibody therapies in Val-des-Sources. That project will maintain 140 existing jobs and create 40 new jobs in the province of Quebec. The third investment being announced today will be granted to Immune Biosolutions, a company in Sherbrooke in Quebec. This investment will develop and move forward its therapeutic candidate, a real made-in-Quebec solution. Moreover, the company will establish a clinical-scale biomanufacturing capacity and create a new accelerated research process.
Biomanufacturing investment, I am pleased to announce $113 million for the next stage of funding to advance the Made in Canada vaccine and therapeutics projects to the National Research Council Industrial Research Assistance Program, which has been helping a lot of companies across our nation. Since the start of the pandemic, this program has provided advisory support and more than $37 million in funding to advance early stage and development research of 6 domestic vaccine candidates and 7 domestic therapeutics candidates for COVID-19. When the 13 recipients complete their current stage of work, the National Research Council will work to advance the most promising of these candidates to the next phase of clinical development. Tous les projets aujourd'hui ont été examinés.
All of today's projects were reviewed and recommended by the experts on our vaccine and therapeutic products working group. I'd like to take this opportunity to thank the members of our working groups for their hard work and their advice to the Government of Canada in our efforts.
Our government invested approximately $1 billion to advance industrial research and development in vaccines and pharmaceuticals and biomanufacturing capacity. Today's announcement is another good illustration of how we are moving forward with our domestic biomanufacturing strategy. It is a strategy which is aimed at reversing a 40-year trend by supporting short-term strategic actions with a long-term vision. Indeed, by investing in our domestic biomanufacturing capacity, we are advancing vaccines and treatments today, while at the very same time strengthening Canada's response to any future outbreaks. Ladies and gentlemen, Canada has the talent, the innovators, and the willing partners to be a global leader in this space. So let's seize the moment. Let's be ambitious, and let's together rebuild our biomanufacturing sector here in Canada. With that, Mr. Chair, I will turn over to you. Merci.
Merci beaucoup, François-Philippe. Merci pour ces excellents.
Thank you very much, François-Philippe, for that excellent news.
To Drs. Tam and Dr. Njoo.
Bonjour à toutes et à tous. Over the past several weeks,
Hello, everyone.
COVID-19 activity plateaued at a high level, with national case counts now on the rise. To date, over 913,000 cases of COVID-19, including close to 22,500 deaths, have been reported across Canada. And over the past week, on average, almost 3,200 new cases and 31 deaths were reported daily. At the same time, about 2,040 people with COVID-19 were being treated in our hospitals each day, including almost 550 in critical care. To date, over 3,600 variants of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these to date. With high infection rates and more contagious variants spreading, we must remain vigilant to prevent acceleration of the epidemic and its severe outcomes. With over 4.4 million COVID-19 vaccine doses distributed and over 3 million doses administered across Canada, federal, provincial, and territorial authorities are continuously monitoring COVID-19 vaccine safety. To date, no unexpected vaccine safety issues have been identified in Canada. Health Canada is aware of reports of serious adverse events in Europe following immunization with the AstraZeneca vaccine, but wants to reassure Canadians that the benefits of the vaccine continue to outweigh its risks. There is currently no indication that the vaccine caused the observed events. Health Canada is continuing to work with international regulators, including the European Medicines Agency, to determine whether there is any need to take action in Canada. At the same time, expert advice on the optimal use of vaccines is being adapted to maximize the benefits of COVID-19 vaccines authorized for use in Canada. Today, the National Advisory Committee on Immunization has released updated recommendations on the use of the AstraZeneca vaccine, including expanding the recommendation for its use from adults aged 18 to 64 years to now also include those aged 65 years and older. As an estimated over 380 million COVID vaccine doses have been administered worldwide, the science is continuing to emerge on real-world use, providing us a greater understanding of the safety and effectiveness of these vaccines across the population. NACI continues to analyze this emerging evidence and will adapt their advice to maximize the benefits of all COVID-19 vaccines authorized for use in Canada, as we aim to protect more people faster, while maintaining the highest standards for vaccine safety and effectiveness. As we all wait our turn to join Team Vaccine, let's continue to cheer from the sidelines and help by remaining vigilant, following public health advice, and keeping up with individual practices that protect us all. Thank you.
Bonjour à toutes et à tous. Ces dernières semaines, la transmission de la COVID-19.
Hello all. Over the past several weeks, COVID-19 activity has leveled off at a high level, with national case counts now on the rise. To date, over 913,000 cases of COVID-19, including close to 22,500 deaths, have been reported across Canada. Over the past week, on average, almost 3,200 new cases and 31 deaths were reported daily. At the same time, about 2,040 people with COVID-19 were being treated in our hospitals each day, including almost 550 in critical care. To date, over 3,600 variant of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these to date. With high infection rates and more contagious variants spreading, We must remain vigilant to prevent acceleration of the epidemic and its severe outcomes. With more than 4.4 million doses distributed and over 3 million doses administered across Canada, federal, provincial, and territorial authorities are continuously monitoring COVID-19 vaccine safety. To date, no unexpected vaccine safety issues have been identified in Canada. Health Canada is aware of reports of serious adverse events in Europe following immunization with the AstraZeneca COVID-19 vaccine. But the department wants to reassure Canadians that the benefits of the vaccine continue to outweigh its risks. There is currently no indication that the vaccine caused the observed events. Health Canada is continuing to work with international regulators, including the European Medicines Agency, to determine whether there is any need to take action in Canada. At the same time, expert advice on the optimal use of vaccines is being adapted to maximize the benefits of COVID-19 vaccines authorized for use in Canada. Today, Canada's National Advisory Committee on Immunization, or NACI, has released updated recommendations on the use of the AstraZeneca vaccine, including expanding the recommendation for its use from adults aged 18 to 64 years to now also include those aged 65 years and older. As an estimated over 380 million COVID-19 vaccine doses have been administered worldwide, the science is continuing to emerge on real-world use, providing us a greater understanding of the safety and effectiveness of COVID-19 vaccines across the population. NACI continues to analyze this emerging evidence and will adapt their advice to maximize the benefits of all COVID-19 vaccines authorized for use in Canada, as we aim to protect more people faster while maintaining the highest standards for vaccine safety and effectiveness. As we all wait our turn to join Team Vaccine, let's continue to cheer from the sidelines and help by remaining vigilant, following public health advice, and keeping up with individual practices that protect us all. Thank you.
Merci beaucoup, Dr. Njoo. Alors, Corinne,
thank you very much, Dr. Njoo. And now, Corinne, we're ready for questions.
Nous allons donc passer à la période de
Thank you. We'll move on to questions on the telephone line with one question and one follow-up.
Take questions on the phones with one question, one follow-up each. Opérateur, première question.
Merci. Thank you. Veuillez s'il vous plaît appuyer sur l'étoile 1 maintenant si vous désirez poser une question. Please press star 1 at this time for any questions. Notre première question est de Raymond Filion de TVA. À vous la parole.
Merci. Bonjour, une question pour Dr. Njoo d'abord.
Thank you very much. I have a question for Dr. Njoo. Has the third wave begun in Ontario? According to you, many experts seem to think that it has. Answer. Thank you for the question. Yes, we are following closely the situation that's happening currently in Ontario. Cases have begun to rise, but it's hard for me or other experts throughout the country or in Ontario to necessarily declare a third wave. Very often, it's only in retrospect that we can tell whether we're on the downhill side of things. But for now, what's really important is to continue to follow public health guidelines. If we don't closely follow public health guidelines, well, it's clear that cases will continue to rise. Vaccination programs are going well, but with the variants of concern, well, I think that is something that's worrying experts everywhere.
Merci. Ma question suivie serait pour le ministre Champagne.
Follow-up
pour un
question
collègue, au sujet de Medicago. Vous en avez
for
parlé en
Minister
anglais tout à l'heure,
Champagne.
le lancement de la phase 3 de l'essai clinique.
Earlier in English, you spoke about
Pouvez-vous nous expliquer ce que ça
phase 3 of
représente comme
clinical
nouvelle?
trials at
Certains diront
Medicago.
que,
Could you tell us what that
compte tenu que ce
represents?
vaccin sera vraisemblablement pas disponible avant la fin de la vaccination
It
au Canada
sounds
contre la
like that vaccine
COVID-19.
won't be available
On peut
until the
peut-être se
end of
demander
the Canadian
pourquoi,
vaccination
ce serait une bonne
campaign.
nouvelle, mais j'aimerais vous
So
entendre
then
là-dessus, s'il vous
one
plaît.
could ask oneself why this is good news. I'd like to hear
Merci,
from you on
Monsieur
that.
Dion. Je pense que c'est une grande
Answer.
nouvelle parce que depuis le départ,
Well,
avec les
I think this is
autorités,
great news
on a
because
essayé
from
de
the very
développer un
beginning with the
vaccin au Canada.
authorities,
Il
we
faut
were trying
savoir
to
que
develop a made in
Medicago, qui
Canada
est à
vaccine.
Sainte-Foy, Québec,
And Medicago, which is in
le
Sainte-Foy in
vaccin
Quebec,
le plus avancé au Canada.
has the
Et là,
most
de voir
advanced
que non
vaccine in
seulement
Canada.
Medicago avance, mais qu'il s'allie avec une grande firme pharmaceutique,
And not
DSK,
only is it progressing,
pour
but
la
it has
nommer. Moi, je
joined
pense que c'est une grande nouvelle
a big
pour le
pharmaceutical
Québec, grande
company,
nouvelle pour
and
le
this is
Canada,
great news
parce
for
que,
Quebec and
vous
Canada.
savez, on avait investi dès le départ 173 millions
From the beginning, we invested $173 million
le développement de ce vaccin
to speed up the development of this vaccine and to increase manufacturing capacity. And what we've learned is that Canadians expect us to take immediate strategic action, but with a long-term vision. That way, no matter what the future holds, I think one of the great lessons of this pandemic is that we will need to be more resilient and ensure that we make supply chains as local as possible to protect Canadians' health and safety. That's why I think this is great news.
Merci. Thank you. Next question. Prochaine question.
Our next question is from Mia Rebson from the Canadian Press. Please go ahead. À vous la parole.
Yeah, Dr. Tam, I'm wondering if you could talk a little bit more about what we're seeing in terms of the variants, how they're behaving. We do seem to be seeing higher percentage each day of those variants. And if we have any evidence yet of what impact they're having on severe disease, on death, but also if the vaccines are showing any impact with them, what evidence at all do we have about that at this point?
Thank you for the question. And as I said in my remarks, there's over 3,600 variants of concerns now identified in Canada. By that, what I mean is the number that have undergone the genome sequencing. There are, in fact, many more cases where we suspect that they're cases of variant concern because they contain these mutations. Provinces have been screening essentially almost all of their cases for mutations. So there are many more underneath these already sequenced viruses so we know it is actually occurring in Canada. So the 3,600 is kind of a tip of the iceberg, and there are many more cases with those mutations. So that is definitely concerning. We do know that public health measures do work. We've seen that in other countries in slowing down and controlling the spread of these variants. But they're, obviously occurring at a time when the population-based immunity is quite low. I think based on our preceding sero surveys, the percentage of Canadians or people in Canada with previous exposure to the virus is low, and then our vaccines are just accelerating. It's great news, but we've got a long ways to go. So under these circumstances, when these variants are accelerating, it's a really sort of precarious time for us, which is why every level of government has to be really vigilant and concerned. Now, I think, what do we know about these variants? You've seen probably some of the studies coming out of Ontario, which suggest, of course, they're more transmissible. When we look at that reproduction number, it's over 1, it's 1.2 or more so far in the context of Ontario. And which means they have the great propensity to accelerate, to that speed of spread is going to be bigger than the previously existing variant or viruses. So that is why I think we are concerned about the variants. Secondly, based on information, particularly from the United Kingdom, the B117 variant is associated now. There's stronger evidence to show it does result in more severe outcomes. So now hospitalizations and also deaths. So I think this is why, we're watching, of course, that epidemic curve really carefully. because there is this upswing we're seeing now. And also recall that what you're seeing now is what happened a couple of weeks back. And so this is not the time to increase your contacts. You need to sort of keep that contact rate as much as you can. You know, people do have essential things that they need to do, but as much as you can, keep that contact rate down. Otherwise, the vaccines won't have time to take effect. So that's what we know. And at the same time, I think we know a bit more about how effective the vaccines might be against these variants and against the B117 variants and others. Certainly, there seems to be good coverage on the whole for the B117 variants and lower maybe for the others. But the vaccines do still offer protection.
Thanks for that. And I'm also wondering if you could talk about the death numbers, which you talked about the number of cases sort of had flatlined for a while and were creeping up again. But in that same time period, the number of daily deaths seems to go down. What do you attribute that to? Is that vaccine? Is that luck? Is there a reason that you can explain why the deaths have gone down?
That's a really important observation, one we're watching really carefully because obviously some of the most high-risk groups are being vaccinated as a priority. The good news is, based on reporting from the provinces, the rates in the over 80-year-olds have come down below the rates for the other age groups now. That suggests that the vaccines might have a good effect. Secondly is that the number of long-term care facility outbreaks have reduced over time. Now, one might say, well, it's because of all the public health measures that's been put to bear. That's possible too. Reducing community transmission rate does have an impact on the rates in long-term care. But that kind of drop is really encouraging. And what we've also heard is that, the number of cases in relation to any of the long-term care outbreaks are smaller than they were before. And so those are really good signs. Now, the number of deaths and hospitalizations, as we all know, are lagging indicators from the cases. So if the cases start going up, it'll be a number of weeks before we know whether that's resulted in any increase in deaths. But I think it is encouraging that those who've been vaccinated first, that over 80-plus age group, their rates are crossing the lines of the incidence of all the other age groups, dropping below all of them. So that's really great news.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. Notre prochaine question est de Philippe Vincent Foisy de Radio-Canada. À vous la parole. Please go ahead.
Oui, bonjour.
Hello. Question for Dr. Njoo, and if the ministers want to jump in, that would be great too. Now, with the suspension of the AstraZeneca vaccine in Europe, what are your thoughts on that? You keep saying that everything's okay, but more and more Canadians are concerned about this or may even refuse to be vaccinated with AstraZeneca. Now, I know that you're going to say that getting any vaccine is better than no vaccine, but what are you telling the people to convince them when in Europe people are saying that it was a better idea to suspend the vaccine? Answer. I'm happy to answer this question, but I will also ask my colleague, Dr. Berthiaume from Health Canada, to answer as well, because he's part of our regulatory system here in Canada. What we're seeing in Europe, in my opinion, is that the authorities are acting in a very precautionary manner, perhaps with an excess of caution, because they're looking into blood clot situations. But when I look at the data, so far, the rate of these types of adverse events is not different than among the population as a whole. That's one aspect. And then the other aspect is that here in Canada, Our AstraZeneca vaccine supply is coming from India. It's from a completely separate lot. It comes from a separate factory in India. It isn't produced in the same location as the lots that are currently being studied in Europe. That's the second aspect. And as for Canadians' trust, well, I personally would take any of the vaccines if it was my turn. And I think that when it comes to vaccines that have been approved here in Canada, I would take any of those. And if we look at what happened in the UK, where 11 million people have already been vaccinated, I think that the experience has been very good and the benefits are clearly outweighing the risks. And I would ask Dr. Berthiaume to add. Yes, with pleasure. I would just say that Health Canada is closely following the situation. It's closely following the vaccine situation in Europe. The European Medications Agency that approved the AstraZeneca vaccine did not suspend it. Instead, some countries have paused their vaccination campaign while waiting for the medication agency's conclusions, which is looking into adverse blood clotting events and is looking into whether that could be linked to the vaccine or not by looking at all of the cases. However, what we could say is that the rate of these events is actually lower than what we would expect for the whole population, because there will be such adverse events that will occur spontaneously within the population. So currently the data is reassuring, and what I can add is that the European Medications Agency has held a press conference. It held a press conference this morning to reiterate its confidence in the AstraZeneca vaccine. It is encouraging countries to continue to use this vaccine in their campaigns. There will be a follow-up meeting on Thursday with more information from the European Medications Agency, but with the information we have so far and with the information we've gotten from the EMA, we continue to believe that it is safe and effective to use the AstraZeneca vaccine. Follow-up question. I hear what you're saying, but some Canadians are concerned because vaccines were produced very quickly. People are concerned about possible side effects, as we've seen in Europe. I understand your rational argument where you say, get vaccinated, the vaccines are safe. But I'd like to understand more about your strategy. What will you do to convince people that are getting vaccinated, that were going to get vaccinated, but that ultimately decided not to get the AstraZeneca vaccine? It's all very well to tell me, but I'd like to hear what the government and Health Canada and the Canada Public Health Agency will be doing to convince Canadians. Answer. I'll start, and perhaps Dr. Njoo will want to add something. Our approach is an approach based on transparency and information. All of the information about assessing the vaccines is available online. I think when it comes to reassuring people, it's all about transparency and information. Anecdotal stories about adverse events from a health product can lead to concern and hesitancy among the population. Right now, I would add that there is a global media focus on the side effects or possible side effects of these health products. And of course, once you're concerned about possible side effects, then you might start linking all sorts of other things to taking that vaccine, even though they're not necessarily linked. What I can say is that in the UK, 11 million doses of the AstraZeneca vaccine have been administered, as well as a high number of Pfizer doses. And there is no difference in the amount of these adverse events between Pfizer and AstraZeneca. There is currently a European investigation happening on some rarer cases. We're talking about extremely rare events, But right now, what I would say is that on the basis of available information, and I would repeat this, there is no specific concern about blood clotting adverse events based on the AstraZeneca vaccine. As Dr. Njoo said, various European countries have taken a precautionary approach, perhaps to reassure the public, and while waiting for the European Medicines Agency's conclusions. But what I would say is that based on what we've seen so far, there's no reason to be concerned about the AstraZeneca vaccine. We are constantly in communication with the European Medicines Agency, and if we do hear that there's a specific risk linked to the AstraZeneca vaccine, then we will immediately take action. We will advise Canadians and we will take all necessary measures. If we do ultimately get information about adverse events, but so far, based on the position taken by Health Canada, the World Health Organization, the European Medicines Agency, and the UK's regulatory body, based on all of this, the benefits of the vaccines, including the AstraZeneca vaccine, greatly outweigh any risks that could be associated with the product. This is Dr. Njoo. I will just add something. I would say that the most important thing is to give appropriate and credible, reliable information to Canadians. Canadians tend to trust their healthcare providers that are on the ground. And I think that's very important. We've already started a series of webinars to give people the right tools and information, or rather, to give providers the right information and to enable them to give the patient the right information and have the right conversations with them. I would say that we are continuing to base our decisions on reliable data, and we are also setting up webinars to give healthcare providers the right information so they can hold good conversations with their patients in order to increase Canadians' trust in the vaccines.
Merci. Thank you. Prochaine question. Next question.
Merci. Our next question is from Ryan Tumulty from the National Post. Please go ahead. À vous la parole.
Yeah, this question is for Minister Champagne. Two of the big announcements that you're making today are in fill and finish facilities, which, while great, aren't really the whole vaccine manufacturing chain. Are you concerned that even with all these investments, we still don't really have a full manufacturing industry for vaccines in Canada?
Well, thank you for the question. Obviously, we'll continue to invest. You know that the mission we have put ourselves is to be more resilient. You know, we've invested in a number. I mean, you have to understand when we started that, and I want to give kudos to Dr. Tam and Dr. Njoo and Dr. Bertillon, but there was like some 324 vaccine candidates, or 200 something. They can be specific on that. We selected 7. And they were widely approved. I mean, the subset that we have, which have been approved in Canada, have been approved in a number of countries. Now, since day one, we have made sure that we would speed up our investments in biomanufacturing. You know, 12 days, I think the World Health Organization declared a pandemic was on March 11, if my memory serves me well. And within days, we had already invested close to 200 million. And within 30 days, we added another 600. So we already had 800 millions to invest, I would say, and to increase our domestic capacity. Now, what we found in Canada, and you probably saw that in different articles, is that the 2 sites where we had, which could do volumes, you know, to attract the big vaccine developers, you need volumes. So one is GSK in Quebec City, which is already doing the influenza vaccine. And you have Sanofi Pasteur, which is the former Connaught Laboratories, which is also doing polio and other type of vaccines for the world. So what I've been doing and what we've been doing as a government since day one, and trust me, I've been texting and talking to about all CEOs that I can find to make sure that we onshore as much of the critical components, whether it's adjuvants, whether it's lipids, whether it's fill and finish, to kind of plug the gap that we had in Canada. And the investments of today, I mean, it's 100 million. The total project value is 176 million in terms of project value. That's quite significant. I mean, if you just take cabs, which I mentioned, cabs will allow us to do on a speed fill and finish capacity about 30 million vials per year. And we're going to continue with Medicago. I had a chat with the CEO. We're trying to accelerate whatever could be accelerated in order to have them come to production as quickly as possible. And you know, Novavax, and with the Royal Mount facility, with the National Research Council, we're still on track to finish construction by the end of the summer. Then obviously we have commissioning and good manufacturing practices by Health Canada to be in a position to produce vaccine by the end of the year. So I would say we're firing on all cylinders to attract as many vaccine candidates which have been recognized to establish themselves in Canada. And one of the key components to do that, I would say, is the fill and finish capacity. And we're looking across the country. Now you've seen 3, but I can tell you we're at least talking to many more in all parts of the country to rebuild the ecosystem.
Yeah, and just as a follow-up, we've heard a lot from the pharmaceutical industry in Canada that beyond these investments, that the climate here is just not great for them, that from patent protection to their ability to sell to multiple, the drug prices are kept low because there's so few buyers, and some other issues around that. Are you looking at some of those structural problems, the patent protections, the tax changes, things like that, to maybe attract more of an industry here?
Thank you for that. Yes, I've heard some of that, but what I remind them is that the world is facing a health emergency. So what I'm saying is that I'm happy to engage in a long-term discussion with respect to some of the irritants. I mean, we said it. We're reversing a trend which started, in the 1980s. So obviously, what I'm saying to them is let's take strategic, immediate actions with a long-term vision, because that's what we need to do now, because not only I'm trying to attract them in Canada to be able to manufacture for our domestic needs, but I think Canada has demonstrated itself to be a very good partner. What I've heard from many CEOs, they say Canada is a safe bet. Stability, predictability, we didn't put export restrictions. You probably heard from Pfizer that if you look at the vaccine, there's more than 100 components coming from something like 40 or 45 suppliers coming from 19 countries. So obviously these companies are very keen that they can establish their presence in places which have been stable, predictable, and making sure there's no too much encumbrance on their supply chain. So I think because of the human capital, because of the investment in research, I think that what I'm saying to them is let's rebuild the ecosystem step by step. I hear you, and we should as a country and as a nation, but we can also at the same time take immediate strategic actions that will help to rebuild the ecosystem. And some of what you see this morning is that, and I can assure there'll be more to come because we are in discussions with a number of players in the industry. And like I said, what I hear is Canada is a safe bet, and that is encouraging for us and should be encouraging for Canadians.
Merci, thank you. Prochaine question. Next question.
Thank you. Merci. The next question is from Glenn McGregor from CTV News. Please go ahead. Your line is now open. La parole est à vous.
A question for Dr. Tam about the situation in Thunder Bay, Ontario. It now has the highest per capita number of cases booming there. And I'm just wondering, is public health monitoring that situation in Thunder Bay? And if so, do you have any insight into what's happening there and whether or not the province should take more action, declare it a hot zone, and respond accordingly?
Yes, I'm aware of the situation in Thunder Bay, and obviously as a provincial jurisdiction, and we can, from a public health agency perspective, can provide support which is generally more technical. But government-wide, there's, of course, federal supports that can be provided, whether it's isolation sites or, support for people who have to abide with the public health measures. And I think Ontario is taking a more regional approach to how they're managing their outbreaks and their epidemiologic situations, so that they are, obviously treating Thunder Bay, I think, differently to maybe other areas where there's less activity. I think the other sort of key message about what's happening in Thunder Bay is that one is, areas that were less affected in the past can easily become the next hotspot. So I think that's definitely something to be conscious of. The other thing is that there are a number of vulnerable settings in whether it's congregate living or shelters or other more vulnerable settings, which you got to give them as much support as possible. Because it actually has community impact as well. It's not just these viruses know no borders, and if it affects certain high risk and vulnerable groups, it's going to impact the rest of the community. So as much help as you can provide in that context, the better. And obviously with the vaccinations in Thunder Bay and elsewhere, that has got to sort of continue as fast as possible. But I don't have specific details as to what supports we may have already provided, but those are the general things that the federal government can help with. But yeah, I mean, I think any place could become a hotspot. And the key, again, is to act fast so that you can get out of that crisis situation fast.
Okay, thank you. Question for Minister Champagne. And Minister, I hope you won't mind me asking about your previous position. But when you were foreign minister, were there any efforts made to repatriate Canadian children in Syria? And wondering if Canada, should it be following the European Union's model, more aggressively and directly trying to bring Canadian children back to Canada, especially if we're hearing reports there's one there who's only 2 years old. I just wondering your thoughts on how actively the government was trying to do that when you were foreign minister, and whether or not that approach should be changed.
No, it's a fair question. I guess when you're a minister of the crown, whether you move around, and I did some of that, you've touched different things. I'm happy to answer your question, and obviously Minister Garneau could provide you the more updated. But certainly, you will remember that we repatriated an orphan. I mean, we said it at the time. These were exceptional circumstances. We had an orphan which we successfully brought back to Canada. We said at the time that one of the paramount I would say objective is to do that safely. As you know, we don't have a diplomatic presence in the region, or I'd say in that country, in Syria. So we have a duty of care to our own employees when it comes to providing consular assistance. In that particular case of the orphan, we mounted a very complex operation with the help of the local authorities. These circumstances were exceptional. Like I said, this was an orphan who was in a camp, and we were able to do that. And I think we said circumstances like that are very exceptional. And I would say, obviously, we are looking at ways how we can provide consular assistance to those Canadians who are there. But you would understand we need to balance that with our duty to protect the health and safety of our own consular officials. And we've said it, we could do it in that particular case because the circumstances were exceptional. And I think we have demonstrated compassion, and we will continue. And there's always ways where we're trying to support Canadians who might be still in Syria.
Thank you.
Merci, thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur.
Thank you. Merci. The next question is from Tom Parry from CBC News. Please go ahead. Your line is now open. Merci.
Hello. Thank you for taking my question. This is for Dr. Tam and Dr. Njoo. This question was asked a little earlier on in the session.
Hi, Tom, we've lost you. I think the line has cut. I believe there is one last person on the line, so we will take the next question from a reporter. Operator.
Please go ahead, Mr. Parry. Your line is now open.
Hello, this is a question for Dr. Njoo and Dr. Tam. I'm not sure if you can hear me. I'm trying to find out whether you think a third wave is underway in Ontario.
I think this is Theresa Tam. I think even the Ontario public health entities, the colleagues in the province have reflected on that. This is an inflection point, I think, for Ontario. After descending on the epidemic curve for that sort of second wave, if you like, haven't even got to the bottom of that second wave, obviously, that they could now be at the inflection point into a phase of resurgence. And that variants may well be playing a part in driving acceleration in the days to come. What actually happens thereafter, from this point on, then depends on the actions that are taken as to whether this is a little bump or whether things might take off. So you've probably heard the statistics on the fact that there may be 40% of the cases are now due to variants of concern with increased transmissibility. So I do think that this is a really, delicate point. And if the public health infrastructure, the testing, the tracing can't keep up with the acceleration, and particularly if there's an inkling of increased hospitalizations, then they will have to adjust their measures accordingly.
Yeah, it's Dr. Njoo. Just to add to it, I think I answered the question in French as well, is that certainly, in terms of waves or wavelets, as Dr. Tam also alluded to, is that Ontario certainly seems to have a slight increase in cases, and so maybe it's an inflection point, and maybe it's a little blip that'll go down. But certainly, I think the important point to emphasize is that what Ontarians do now matters, because obviously we'll see the consequences, in a couple of weeks if the cases continue to rise, or if, let's say, hopefully the right measures are in place and people continue to follow public health practices, so that it just becomes a tiny blip in retrospect rather than obviously a continued increase. As I said, sometimes you don't know what wave you've had until maybe you're actually on the downside of the epidemic curve. So I think the point's taken. I think everyone's aware that the variants, especially in Ontario, are continuing to continue to become a greater proportion of the cases that are reported, and it's something I think that bears watching. And certainly, I think vaccination is as it unfolds is a good sign. But in the meantime, as we've stressed numerous times, people need to understand and appreciate that the following local public health measures and individual practices is key at the present time. Thanks.
When do you think we'll be able to say when and if we are in a third wave? And just in terms of the variants, I mean, how big a role? I mean, is that what's going to be driving a third wave if and when it comes?
Theresa Tam, I think they will play a key role as I said, in the Ontario context. You've seen the variants taking a bigger and bigger part of the pie chart, if you like, of what's happening in Ontario. They're now at 40% of the cases, and that could easily accelerate to 50% and beyond. So I do think with the B117 variant in particular, it's now become it's in over 100 countries. In the UK, it's like 99% of the cases. So that may well be the driving force. Not that the pre-existing circulating viruses won't play a role, but this is the accelerant to a potential for resurgence. And just to add that Ontario isn't alone. There are other areas of the country where we're beginning to see some, beginnings of an increase. At the same time as we're trying to get through the sort of March break, spring break periods, and sort of this is a period of concern as trying to ensure that the members of the public don't during these times of breaks is when we can see an acceleration of cases, because people have a natural tendency to try and congregate in larger numbers. And so it's not the right time to do that. And if everybody plays their part, we'll get through this next month as the vaccines are rolling out, and we'll be in a much better shape.
Merci. Ceci met fin à la conférence de presse d'aujourd'hui. Thank you, everyone. This puts an end to today's press conference.
You've listened to it live here on CBC News Network, the update from the Public Health Agency of Canada on the status of COVID-19 across the country. And we did get some news there of new investments into manufacturing of vaccines, increasing facility load, et cetera, here in Canada. CBC's Karina Roman was also listening along with us. For those of us, those viewers who may just be joining us, Karina, the nuggets from this update.